Are you eager to dive deep into the future of healthcare? I'm Jim Weiss, founder and chairman of Real Chemistry. Join me on my podcast, Get Real with the Chairman, where we connect the dots between healthcare innovators and the communities they serve. I'm here to simplify the complexity of today's healthcare landscape with some of the brightest minds in the industry. Tune in to hang with us on Health Podcast Network, Apple Podcasts, Spotify, or your favorite podcast platform, and start transforming your healthcare mojo today.
All those nurses that are coming to graduate or those that might be new into the area, they hear this buzz of, oh, you don't want to go to that hospital. You really want to stay away from that unit. You're not going to get anyone applying. It's going to be very difficult. So that turnover, recruiting, training, all that, it's just going to cost more money down the line. So it has a great impact.
What are microaggressions and implicit bias? And how do we recognize, address, and mitigate these issues that can undermine morale, employee retention, and workplace culture, all while endangering both patients and staff? Let's talk all about it with Dr. Christine Frazer, a registered nurse, clinical nurse specialist, certified nurse educator, and academic educator from Walden University, right here in episode 501 of The Nurse Keith Show. Hey there, this is Nurse Keith. This podcast is about you and your personal professional development, your career, and the healthcare system writ large. And I'm here to share education, ideas, and informative interviews with some of the most inspiring people from the worlds of healthcare, nursing, entrepreneurship, medicine, and beyond. I always love having you along for the ride, and I thank you from the bottom of my nurse podcaster's heart for being part of the growing Nurse Keith Nation. If you'd like to help other people find the show, you can leave a rating and review on Apple Podcasts or Google Podcasts or Spotify. And if you want to become a patron, you can go to patreon.com, patreon.com/Nurse Keith, and give as little as $2 a month just to help me out, do me a solid, to help me keep the lights on and things rolling here at the Nurse Keith Show. You can also share the show with anyone who you think might enjoy it or get something out of it. And no matter how you're interacting with the Nurse Keith Show, including listening right now, like you're doing, thanks for being here. Head over to nursekeith.com to find the show notes for the episode. And the show notes are always in the podcast app where you happen to be listening on the device of your choice. As I said today, we're here with Dr. Christine Frazer of Walden University. And Christine, it's great to have you here. This is the first episode airing in 2025. So we're kicking things off in a good way. And I want to start by asking basically a simple question first. What are microaggressions?
Well, thank you for having me. And what a way to start out the year 2025, hoping we can eliminate microaggressions in nursing. Microaggressions are those subtle behaviors, those actions, those attitudes, the insults that are directed towards individuals. Historically, though, marginalized groups, often without intentional malicious intent, but sometimes with malicious intent. Those marginalized groups can be, based on those of different race, ethnicity, sexual orientation, their socioeconomic status, whether they have a disability, their religious beliefs, how old they are, physical ability, the list goes on and on.
And are microaggressions considered a form of incivility or bullying? Are they in that category, or are they categorically different?
Well, they certainly can be within that category. I mean, we are incivil. We, with microaggressions, we have those, we can roll those eyes, have those attitudes like we can have towards someone else and be very incivil towards them. And absolutely, they're very much connected. But microaggressions are specifically looking at someone's behaviors, actions, and their insults, which are directed towards those of marginalized groups. So they do intertwine for sure.
So you mentioned things like rolling of the eyes, those are super common, but you also mentioned insults. And, when somebody directly insults you, either your work or something about your personality, or maybe one of those characteristics you just mentioned. Is that a microaggression when they actually say something direct to disparage you? Or is that not a microaggression because it's so kind of like explicit?
It really just depends how they phrase it exactly, to
Oh,
tell you the truth, Ken. I mean, it's basically this, they have this unequal power relationship between, it has to do with social groups. And I thought it was very interesting because they can communicate in a hostile manner. They can degrade, like, the new nurse, or, oh, that student's on the floor again. What do they expect from me? Or that patient in the hallway is so demanding. Who do they think they are?
mhm.
Um, so those types of comments, it can be intentional or it can be unintentional.
Okay. So unintentional being something someone does out of like knee jerk response and they're not even conscious that they're doing it.
Um, they could be unconsciously knowing that they're doing it. However, in my experience, when it comes to microaggressions and unconscious and consciously, they're aware, like, let's say we're in a group, we're talking, and I perhaps see another nurse who just really hasn't, just rubs me the wrong way for whatever bias I might hold. And they walk into the lounge, and I can, like, while we're having a conversation about the patient care or something going on in the unit or an after event from the unit, I just kind of turn my back towards them and continue talking to the group. That's a microaggression. That's blatant microaggression. It's intentional. Sometimes there are, obviously intentional, like I mentioned before, where we can just roll our eyes when somebody walks into the room. We sometimes might not even notice we're rolling our eyes, although other people will notice we're rolling our eyes.
Interesting. So when you are in a workplace and there appears to be, or it's very clear that there's a culture where microaggressions are very normal, like it's just part of the culture. Um, what can an individual nurse do, like a staff nurse, if you know you're in that sort of culture? Should you just run the other way and get another job? Should you address it? Do you like, what do you do when it really seems to be normalized behavior that everybody just either does or they accept that everyone else does?
That's so true, because you look at an organization and the whole culture, it's contagious. It becomes toxic in that environment very quickly. It impacts the reputation of the organization, especially now when we're so in need of nurses and healthcare. And this behavior, people are going to run, like you said. They're not going to come. The reputation is going to be diminished when you're looking for new staff, new employees, and even patients, to that matter. So what can we do is really, there's several things within the literature that help us to define some strategies to address microaggressions in nursing. And the most important thing is to recognize the impact that they have on others and those around you, and to do something about it, those strategies. There's several strategies out there that one can utilize. One, you have to confront it. You have to confront it, you have to communicate about it, and you have to educate about microaggressions. You just don't run and hide. Certainly, I encourage people to pause a minute or two, to reflect a second, gather your thoughts, not speak quickly in an argumentative manner, and quickly, just explode. Really think about it. And then once you have your thoughts down, go ahead and confront that perpetrator, that protagonist, by reflecting on what they said, like, hi, Keith, I was in the lounge and I saw that, when I got my food out of the microwave and the scent of the smell from, whatever I like from my cultural upbringing, that type of food, you kind of rolled your eyes and held your nose and walked out. that's a microaggression,
Mm.
and I was uncomfortable about. I wouldn't say that's a microaggression. I would say, I'm really, I was a bit taken back or a little bit uncomfortable. Next time I'll try to, and you just try to open up that conversation, that door. When my colleagues and I from the National League of Nursing Leadership Academy this past year, we took a deep dive into looking at microaggressions and implicit biases and stuff. And we did write an article about microaggressions. And one of the suggestions was when it comes to confront and communicate and to educate, I heard you say this. What did you mean? Get that clarification. Communicate. When you said this, I felt angry or I felt awkward or I was uncomfortable because I'm new and I really wanted to belong to the team, or because I'm transferring from my pediatric floor to come down to help out in the med surg adult. I'm not used to adult patients, something like that. And then to end up with educate, when you said this, whatever it was, it implies I don't belong. I'm not valued. And that, discourages me from coming to work. You have to confront it. You have to communicate your thoughts and you have to educate them on what the impact was.
So I heard you saying something like what we used to call I statements,
Mm-hmm.
when you fill in the blank, when you
Mm-hmm.
do this action, I feel blank, right?
Mm-hmm.
So
Mm-hmm.
you're not coming out with blame,
Right.
and you're not yelling, you're not attacking, you're turning it back to how you feel. Like when you do blank, I feel blank. And I also noticed you're not saying you made me feel bad, or you
Right.
made me feel, because then that feels more like you're blaming, and that escalates the conversation, doesn't it? When you come back sort of with a more kind of aggressive
Mm-hmm.
response.
Correct. It's like if I was a student, I'm a nurse educator, and in clinicals with students, I can recall, um, you know, nurses, sadly, sometimes we continue to eat our young. And so a student nurse would be working with a seasoned nurse. And for example, the seasoned nurse would say something. So I would teach them to, hey, go back to them and educate. Hey, Nurse Susie, when you said I'm not organized or I didn't take the vitals in the right way or fill out the paperwork, it certainly applies that I'm learning and I'm new. Can you perhaps help me to, give me some pointers? That's kind of that lead in. It's letting them know how it made you feel. But it's also letting them know and implying that, hey, I am new. This makes me feel uncomfortable, or it makes me say, I need help. And with your expertise, can you join me in this journey? It totally transforms the situation more into a positive light in that experience.
So it sounds like, someone has, let's use the word perpetrated, because use the word perpetrator. So someone has perpetrated a microaggression or series of microaggressions, and you feel very uncomfortable, hurt, etc., right? Rejected, whatever. There's so many ways in which you might respond and feel. So someone perpetrates that in your direction. So what I'm getting from what you're saying is that you're telling them how you feel, first of all, and you're naming what it is they did, because maybe they didn't even know they did it, right? Could have been
Mm-hmm.
unconscious. And then you're trying to turn them actually into an ally, because you're saying, I don't feel like I belong, or I feel like maybe I'm not doing this right, and your expertise could actually help me. So you're not pandering to them, right? You're not giving them
Correct.
like false flattery, but you're trying to sort of bring them into your camp, right? You're trying
Mm-hmm.
to become allies.
Mm-hmm.
And you've seen it, and does the literature support that this kind of response is more often than not effective?
Absolutely. The research points to this and other methods. Another method that you see within literature is called vitals. I just think it's great how they make this uh, kind of like honing on the medical side of things. So vitals, I listed it, validates your own feelings and experiences. So just like what we've done, validates our own feelings. Inquire to obtain more information. Can you tell me, what bothered or how I could, done it differently with my assessment this morning, or responded or acted, asked better questions, sort of thing. And then it says with the T, take time to mirror or reflect. That's so important to really reflect on what you've learned, what happened, what resulted. Assume the best is the A, which I thought was fantastic, because you always want to assume the best, and you want to seek clarity, the need for clarity. And then the L is leave opportunities for follow-up. Never like slam the door, even just say, you know what, let me get back to you in a minute. Or can I come back to you if I further question or I need to speak with you more? And then lastly, the S, speak up on behalf of others, even as that bystander. We just can't, I see it happen all too often is we all have to, it's a team, and we all have to speak up properly, but on behalf of others too, that might not be able to speak up for themselves.
So vitals. So V is validate. I is inquire, right?
Mm-hmm.
T is take time, right?
Mm-hmm.
To mirror, to reflect. A
Right.
is assume the best.
Mm-hmm.
And then what is the L again?
Leave opportunities for follow-up.
Leave opportunities for follow-up, And then S is speak up.
Speak up. Mm-hmm. Correct. Speak up.
That's a nice acronym. I like that one.
Yeah.
Do you know who developed that?
I have no idea.
Mm-hmm. That is a good one.
I just remember confront, communicate, and educate impulse. So those stick in my head.
That is a good one.
We use a lot of acronyms for nurses in nursing. Mm-hmm. So vitals was very clever.
Yeah. So that is a good one. And I'm curious, their impact can be pretty pervasive when you have a culture of microaggressions. But what have you seen, and what does the literature show in terms of the impact universally on individuals, and then on teams and on organizations? Like what are the sequelae of this sort of culture becoming normalized in an institution or facility? What happens?
Well, it certainly impacts the individual, whether it's their overall health, their well-being. We can only imagine that I'm sure many of us have been faced with microaggressive behavior towards us. We have that anxiety, just coming to work. What are we going to face? That increased anxiety. Who's my charge nurse today? What team am I going to be assigned to? Do I have patient in 302A again? All those questions through our head. And that causes stress, anxiety. We become overly exhausted. Our well-being, our health, it just goes downhill from there. Sometimes in an organization, and more often we see more in the literature than not, again, my colleagues and I did major research on nurse burnout. That's going to result from that. And it just will continue to rise and increase. And, there's health consequences with burnout. There's organizational consequences with burnout, and microaggressives that do not get quickly under control. It can just have a spiraling effect on the individual, the team, the organization in the long run. I mean, you'll have turnover. You're losing very qualified people, perhaps, those that will be very qualified and supportive of the organization. They're walking away. You've got an environment that lacks motivation. The staff is frustrated. They don't want to work with one another. The cult culture, like you mentioned before, it's very, very toxic, and as I mentioned, it impacts that reputation. It impacts the community that you serve. It impacts the leaders. It's the whole kit and caboodle, and ultimately it costs the organization money because as nurses are rampantly exiting or the evaluations and the reputation of the organization begins to plummet, here's an organization left with, oh my goodness, I have to find new nurses. Who am I going to get? And guess what? Guess what spreads faster than great comments? Negative comments spread a lot faster than great comments. So all those nurses that are coming to graduate or those that might be new into the area, they hear this buzz of, oh, you don't want to go to that hospital. You really want to stay away from that unit. You're not going to get anyone applying. It's going to be very difficult. So that turnover, recruiting, training, all that, it's just going to cost more money down the line. So it has a great impact.
It's pretty amazing to think about how people making small actions and like little things, expressions, actions like rolling of the eyes, turning your back on someone, how that can mushroom into these pervasive impacts that you're describing, like an organization losing money, losing reputation, staff attrition, patient safety decreasing, medical errors going up. Like that tiny little piece of the culture isn't so tiny after all when you look at it. Like just those little actions that people take that seem so microscopic in the scheme of things can have such a universal impact. And when we come back from the break, I want to talk a little bit about your career and what you've done and, where you've traveled along the way to get where you are. And then I want to get into implicit bias, because that's the other part of, sounds like your expertise and the stuff you think about and write about and talk about with your colleagues. So we'll be right back with the second half of episode 501 of the Nurse Keith Show with Dr. Christine Frazer, nurse educator, clinical nurse specialist, and academic educator from Walden University. So hang in there and we'll see you in just a moment. And welcome back to the second half of the episode. We're here again with friend of the pod and my new friend and colleague, Dr. Christine Frazer of Walden University. And Christine, prior to the break, we were talking all about microaggressions, and you mentioned your work with the NLN, the National League for Nursing, and I want to touch on some things related to that. But first, I want to ask you, I mean, you're an RN, you're a clinical nurse specialist, you're a nurse educator, you're an academic educator. Very briefly, like what has been the arc of your career? Did you, where did you start out and how did you get to where you are? What has that journey been like for you?
It's been a great journey. I'll tell you, I'm such a privilege of being a nurse since 1985. And I love being a nurse. I went through the entire life trajectory of the population that I've cared for. I started out in the neonatal ICU at the Medical University of South Carolina back in the 80s, which you can only imagine how that was. And fast forward, in NICU for 6 years, went to Penn State University, worked with the Hershey Med and the 8+8, had that capability. The first conjoined twin, it was fantastic. And then from there, I went from peds all the way up to critical care with adults and focused in cardiac, and had the pleasure of, working with patients that had, the first artificial valve put in or the heart bypass pump. I mean, all those things. It was just amazing. And then that trajectory led to a bit of school nursing, some home health nursing, And then I ended in geriatrics, older adult care, where I really focused on older adult care. Again, we see microaggressions and stuff happening and burnout happening a lot in that area. But really looking at the person as a whole, that respect they deserve, and leading teams there. And throughout that journey, I've always stayed also within education. So I started at a university, a Big Ten university, and worked with undergrads, LPNs, and associate degree. Then I moved up to baccalaureate, led and started a clinical specialist program at the Big Ten University. And so I worked with those master's and graduate students, transferred into an online environment for the last 15, 16 years. Loved it, love it, continue to love it. And what I love about the whole field in education and my mission, it's honestly, I think as nurses, I believe we all desire, I want to be a social change agent. That was my whole mission in life. I was fortunate that my mom and my father were both social change agents. So I grew up with that being very deeply instilled in who I am. I had a mother that started the first ambulance in the community that we lived. I had a mother that also, started Meals on Wheels, started the Girl Scouts Association in our community. Just such a transforming social change agent, and a father as well. So I kind of grew up saying, I need to make a difference. I want to be a positive influence in the lives that I touch, no matter if it's with the neonatal intensive care unit, those parents, those working with those infants, all the way up to the older adults. And now the next generation by educating students, fellow nurses, to be the agent of change, to continue the torch forward. We need to positively impact nursing environment, and care of others. So that's what I'm here for.
Wow. That's a wonderful story. And you obviously haven't, done very much. I mean, gosh, you've just rested on your laurels for 40 years. No, you've accomplished a lot. You're have your doctorate, your PhD, you've done it all. And,
I research, I do a lot of
research,
publication. Mm-hmm.
Yeah. You work with the NLN. So you've been around the block and been a real leader and voice for change and change agent. So thank you for doing all of that wonderful work in the world. And, circling back to our conversation, I just wanted to ask about implicit bias, because we've talked about microaggressions. So what is implicit bias? Let's just define it.
Implicit biases, it's very similar to microaggressives. However, these could unconscious, perhaps, biases. Someone's attitude, their behaviors, their tendencies that they prefer or favor or evaluate more positively than one group related to another. So that's kind of what it all entails. And again, it intertwines with our microaggressive behaviors. Our biases can intertwine with those behaviors. Implicit can be conscious, or is it unconscious? Most of the times we're seeing that unconscious implicit behavior. I do want to touch on what I thought was really interesting when I started to research this in this topic for the NLN and develop a toolkit that I have, is I went all the way back, and much of the literature talks about Freud. Of course, we all love Freud. Back in the early 1900s, he looked at this iceberg theory. And I thought, when I talk to my students, I'm like, this just depicts it so beautifully, because we have that tip of the iceberg where it's the conscious awareness, that visible tip. They're aware of their thoughts, their perceptions. If I see somebody coming that, let's say, might be overweight, I know I have a bias against somebody being overweight. And then right just below that surface is that preconscious, those thoughts, those feelings, those memories that we might not be aware of, but one little thing that you might say can jog it and bring it up to that conscious, oh, remember when we saw that, blah, 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 and it could bring it up to the conscious. And then the very last part of that iceberg, the area where we just do not see, it's real deep down into the water, is that unconscious. That's, it's submerged. And that's usually that unseated, that deep-seated memories that we just cannot gather from. And so I thought that was very interesting when how Freud put that way back when in the early 1900s, because it's so true.
Wow. Okay. I like the tip of the iceberg issue.
Mm-hmm.
There's so much that's unconscious that we don't see, that we don't recognize. So, in terms of this work you did with the National League for Nursing on implicit bias, you just alluded to it. You mentioned a implicit bias toolkit. How does the toolkit work? What does it look like? Who can access it? And how does it help us when it comes to identifying and counteracting implicit bias?
Well, thank you for asking. And yes, I mean, implicit bias is really detrimental. It's detrimental to healthcare. It's detrimental to teams and how we all work. And implicit bias affects everybody: nurse, patients, the community, the organization. It affects their quality of life. There's consequences because of that. So I worked a year long within the nursing leadership at the NLN Leadership Academy. I was one of 10 esteemed colleagues throughout the United States that were selected to come together in this leadership academy led by Dr. Sandra Davis. And in that academy, we choose an area of interest and how we'd like to be a change agent in nursing. And mine was implicit bias. As a nurse educator, we want to grab and go. We want to have less time on making something and have something ready prepared for us. And in my doctoral dissertation, I was very much a proponent of active learning and not just learning by lecture or PowerPoint. So I wanted to do active learning, and I wanted to talk about implicit bias. So I decided with their support to make a toolkit. It's about 70 pages in length, where I did such a humongous deep dive into the literature regarding implicit biases and what's out there is currently exists in teaching strategies, et cetera. And I created some additional strategies on my own, and I put it all together. So instructors, whether you're in clinical or in the classroom, wherever you are, even nurses, even staff leaders and managers can grab this toolkit and the strategies in it and say, you know what, for 10 minutes, I'm going to bring my group together and talk about this. Or for 10 minutes, I'm going to, talk about one of these strategies. Or I had a friend write a beautiful poem, and I included in the toolkit. So it brings thought to their poem as they wrote about how they feel discriminated against or biases that they're facing. I had pictures, even going back into the literature way back when obviously my children were growing up, there was Abercrombie. And they came out with these T-shirts way back when that were very offensive to people. And so even putting pictures of these different logos, how different T-shirts are discriminatory against and present biases. Songs, I led into famous songs out there, current and in past, that I would take music literature and say, have your students listen or have your group listen to this. What biases are coming across in this song, in this music. Also looking at commercials. I mean, we have Mrs. Clean and we have Mr. Clean. And there's lots of different commercials out there that you can pull from to say, let's bring awareness. What do we see? How can we make the change here? So besides poems and videos, there's so many phenomenal videos that are available. You just have to take the time to really search and pick out. We're so quick, like we just talked about with microaggressions, we're so quick to just jump to the conclusion and not really get a sense of where the person's coming from, what's happening behind the scenes. And so our biases, implicit biases, or that can be joggled, perhaps, if it's right underneath that level that of the iceberg that we can bring it more to fruition when we see one video was walking about a physician and take time to walk in their shoes. And it was a story, and I have an activity for them to pause at a certain point, because during this video, you see these individual, this parent is waiting for the surgeon to come to do surgery on their child. And they're getting so upset and they're talking to all the staff. It's just building and building and building. And it's the number one surgeon. He comes, he shows up, and then you hit pause. And then you learn, because I have all these assumptions, I'm thinking all of these things. And then you find out, yes, he just buried his son and he was coming to do your surgery. So it's all those hidden things we're not consciously aware of that can change our perspective. So I have, the videos in here, the poems, the songs, like I said, the artwork, the t-shirts. I have lots of exercises for students to work together in groups, to write their own poems, to write their own skits, and activities to bring awareness. Again, it's just bringing awareness. We have also the implicit association tests, the IAT, that everyone can certainly do. I think there's like 18, it continues to advance and change, but as of today, you can go on the IAT website through Harvard, and it's free for everyone to take to get kind of an awareness of their implicit association. And whether it's on their religion, weight. Speaking of weight, I've got a section. Weight bias was a big thing I wanted to include in my toolkit, and I did. So there's lots of information out there, great insight into things you would never think about when it comes to weight, and the challenges they have with getting care, receiving care. I also have sexual orientation bias, where I show students videos of a kid laughing, smiling, singing, and then it pans out to see it's either two dads or two girls, two ladies. So it's a very eye-opening way to bring awareness, and especially in the healthcare, to shed some light on biases that exist, and then take them to the next step of, what can they do about it? What do they need to do about it? And the first step, obviously, is awareness, and trying to start there.
That sounds fantastic. And who can access the toolkit and where do they access it?
Great question. It is in the process right now of we're trying to get it online. I'm going to try to work through my organization to get it online and made available to our colleagues and to our students and to other nurses and connections that we have through the organization with other healthcare facilities. So it is just finished here. It was a year-long project. So now we're in the process of how do we get it out there now, and what avenues do we have?
Okay. Well, keep me posted on that, and we can put it up on LinkedIn or something and make sure people have access to it. And they can also look up or Google implicit association test Harvard, and I'm sure that'll come up if they Google that. So those are great tools, and I look forward to that toolkit being more widely available. And it sounds like it was a long process of getting there. I just wanted to ask one more question before we wind down. And I wanted to ask about nursing students. Every nursing school, every class has its own culture. And I remember what the culture was like in my nursing school experiences, 2 different programs I went through. And I'm curious, are schools addressing things like implicit bias and microaggressions, or are a lot of schools sort of blind to this issue and they don't talk about it because basically it's not on the NCLEX, so they're not really addressing it, So is this becoming part of the wider conversation?
Absolutely. At least at our school, we are a social change agent school. My university, very much a proponent of groups, multiple groups, welcoming insights from all perspectives, collegial work, student work together. We're very much in support of that. So, we do at our program, again, a program of social change. We do a lot of education, training, bringing awareness, even to our student population, especially in healthcare, in our nursing programs, whether it's the RN to BSN, the graduate or the doctoral program. we're definitely talking about biases and what they might face out there in healthcare, what they're seeing in healthcare, and that we're giving them the tools, bringing them awareness of the tools and how they can handle these situations. And that's so important for every school. No matter if you're in a public institution, a nonprofit, or a profit institution, you definitely need to make students aware of there are tools, there's ways to address this. I'm sure we can all recall, Keith, the time that we went to school back when, whether at whatever level, we can remember distinctly at least one moment that we hit pause. I can always remember my one moment that I hit pause, and it was simply an instructor saying something to me, and it made me hit pause. And I never looked back, and I totally changed my trajectory. So I think that's important. And that's why I feel like this toolkit is important, so that it can be in the hands of all instructors, all leaders, those within the hospital organization, anyone, to get it out there.
That's great. And I'm glad Walden has this culture itself of being change agents, that it sounds like it's right. Intrinsic to the culture at Walden from the leadership down. So that's really great to hear. I like knowing that. And before we end, I have 4 quick questions I like to ask all my guests. Are you game for a quick lightning round?
Oh, gosh. Yes.
All right.
Yeah.
All right. So, of everything there is to possibly understand, what's something about life or human nature that you really would like to understand?
I certainly would like to understand more about my purpose.
Wow. Oh, wow. Okay. Your bigger purpose in life.
My bigger purpose. I mean, we all have a purpose, but what more? What more can I do? What more? How more can I help? How much more can I do to continue to make a difference?
That is
I'm a
really,
forward thinker.
You really are. That's really beautiful. And you've accomplished so much already that's kind of mind blowing that you'd be asking that question, but I'm not surprised. I'll just say that. Okay. Second question. Who's one of your heroes? It could be someone from your personal life or someone, famous, and they could be living or dead, just somebody who's just one of those people for you.
Well, I would definitely say my mother
Yeah.
is just, and my father as well. I mean, how fortunate, just how fortunate we are to grow up in a family that it's not about them, it's about others. And it just sticks with me in everything I do. It's not about me, it's about others and making it better for all. And I truly, truly think it's because of them and the values that they shared in their actions. Is not just what they stated. I distinctly remember it all through their actions. It just made me who I was and who I am.
Wow. That's beautiful. What a family to be part of. That's lovely. Thank you for sharing that. All right. Third question. What book or film even changed your life or impacted you in a really significant way? It doesn't have to be a favorite, just one that stands out for you.
Oh my gosh, I can't even think of one. I cannot think of one. So many, really, well, the book, there's a lot of books that I read, but I read a lot of books that help me to become a better person in my walk of life. And I'm very much that type of person. And I'm always seeking to expand and explore movies. There's just, I can't even name a movie that really made a specific impact. I can't recall a specific movie at this point. So,
but for you, it's all about what can make you a better person. That's what I get.
It really is.
Yeah.
It really is.
That makes a lot of sense based on who I perceive you to be. Okay.
Mhm.
So last question. If you were named queen of the world tomorrow and you had ultimate power, what would be your first act as queen to improve the lives of your subjects? And you could do anything.
Well, first I tell everyone to say, God save the queen.
There you go. It's a good one.
Yeah. But what would be my first act really is listen. It would be to listen.
Mm-hmm.
My first act would be to everyone to just hit pause and listen to someone other than yourself.
That could change the world, couldn't it?
It could, couldn't it?
Yeah, because think about it, all the issues in the world, right?
And then 2, take time to put on their shoes and walk in them.
Mm-hmm. That's lovely. Wow. I love that. See, all of your responses to those questions just fit so perfectly with just like what I perceive your whole life trajectory and purpose have been. So thank you for doing such great work in the world. Thanks for educating nursing students and being part of that academic world that's so important. And thanks for being a change agent. I mean, you're an amazing person, and I'm sure Walden is thrilled to have you there. And we'll have links to Walden University in the show notes, waldenu.edu, and we'll have a link to where they can find you, maybe on LinkedIn. So we'll make sure people can get in touch with you and let you know that they heard you here. So thanks for gracing the airwaves and being here on the very, very first episode of 2025.
Thank you for having me very much.
Well, there you have it. Thanks for listening to this episode of The Nurse Keith Show. The show notes will be at nursekeith.com or on the app where you're listening on your smartphone or device. If you need personalized holistic career coaching, check out nursekeith.com and Nurse Keith Coaching. Mention the show and get 10% off your first coaching package. And we are members of the Health Podcast Network, and you can find them at healthpodcastnetwork.com. And I am always grateful for the adroit production and editing of Rob Johnston of 520R Podcasting. And before we say goodbye, I'll leave you with this quote, one of my favorites by the musician Robert Fripp. May my living honor my parents. May my living repay the debt of my existence. Anyway, be well, dig deep, seek joy, keep in touch. This is Nurse Keith saying adios till next time from beautiful Santa Fe, New Mexico, and the wonderful Dr. Christine Frazer saying arrivederci from
Tampa, Florida.
All right. Thank you, Dr. Frazer. Thanks to everyone for listening. And we'll catch you, of course, on the proverbial flip side.